my name is Maria Annerly, and this is my presentation on pre-trauma training. Before going into training in depth, I'd like to touch briefly on screening and testing. When studying populations of people who have been exposed to high stress incidents or experienced certain traumas, and then gone on to develop certain psychopathologies, including anxiety, depression, or PTSD, researchers have compiled lists of shared characteristics, and some have been identified as factors that increase the risk of developing those anxiety, depression, or PTSD conditions. These include childhood trauma, workplace and social experiences as a female, prior psychological problems, introversion, neuroticism, and maladaptive coping strategies. And just to touch on the second one briefly, this is talking especially about the rates of certain negative experiences occurring to females as opposed to males, and the awareness of those increased chances of something negative happening can highly affect the mental well-being of a female, as well as other scenarios such as incidences of sexism occurring inside and outside of the workplace. These are all static measures of psychological well-being or history, but dynamic measures have proven to be slightly more predictive, although neither is definitively predictive. HPA looks at different brain activity and locations, and skin conductivity can also be used. Moving on to training, there's many different kinds. Operational training has been shown to be more effective than stress management training. When people are confident that they're able to do their job correctly, especially in the areas of first responder agencies and the military, as well as other ones like humanitarian workers, then their stress is lowered. Stress management can be very helpful, but it's already ingrained a lot into operational training. Leadership perception and capability is highly impactful to the occurrence of those psychopathologies discussed earlier. When people are confident that their leaders are capable of taking on their responsibilities and handling them, whether this is in actuality or just in perception, their stress is again lowered. Resiliency training looks at reducing vulnerability, and vulnerability can be discussed in terms of likelihood of a risk occurring or the consequences. And the likelihood of experiencing trauma on the job can't really be changed. That's inherent to a lot of professions, but the consequences can be lowered if you break it down into contributing factors. This looks at ones that can be modified easily, such as behavioral disengagement, cognitive bias, suppression, or static hyperfixation on events. It is important to process things and to think about them, but staying in a very static mindset and focusing on it too much can inhibit processing and moving past an event. Physical exercise has been proven to be very helpful in increasing psychological well-being. So as part, not a standalone pre-trauma training program, but as part of one, it can be extremely helpful. Certain methodologies may be used, and they may be used alone or in combinations. Cognitive behavioral therapy, or CBT, looks at the way that we process information and then how we think about it. So when a first responder, say a firefighter, is on the scene of a fire, what they think about the fire, what they think about the situation, and the way that they think about their responsibilities can impact the way that they process it later on and whether they develop PTSD from the event or not. They can be alone, one-on-one, like with a therapist, or group-based. Group-based has the big benefit of facilitating social support, and social support is a very big protective factor that has been shown with research. Biofeedback can be controlled. This is our automatic responses to stress and to our environment, things like your heart rate, your breathing rate, sweating, shakiness. These are things, or even eye movements. And once you learn to identify them, in some instances you can control it, which lowers stress. So biofeedback can be controlled by purely physical methods or through things like CBT. Stress exposure training takes participants and exposes them to stressors in a controlled environment so that they can practice these methods of reducing their stress and do it with the least amount of danger possible. Psychoeducation can be a type of pre-trauma training or a part of one. It has variable and disputed effects on preventing things like anxiety, depression, or PTSD, but it still can be useful in other contexts. It generally picks several modules that discuss things inherent to every officer or personnel um, or organization member's experience. Things like stress, sleep, anger, substance abuse, and mindfulness all exist within the day-to-day realities of the job, and they can be talked about in a positive or a negative light. So stress can be good or bad, distress or eustress. Anger can be useful when let out correctly. It can also be harmful. Sleep can be too much or too little. Substance abuse is a prevalent problem. All these things are just tools, and when taught to understand and to use them, as well as the harm that can come from using them wrong, then people can understand how they impact their well-being and how to prevent as much as possible. Strategies for dealing with mental health crises or struggles in yourself or others may be discussed. So recognizing when somebody else, like a coworker, is having a panic attack, or recognizing signs of anxiety within yourself so that you can take a moment to calm down or to lower your stress can be really helpful, as well as recognizing signs of bigger issues like chronic ones like anxiety, depression, PTSD, psychosis, self-harm, suicidal behavior, etc. can not necessarily prevent them, but by recognizing them, treatment can be sought much faster. Social dynamics and needs can also be taught. It may seem simple, when you have friends that you can talk about to things, that helps, but that doesn't come easily for everybody. Understanding, that community is a basic need of humans, and understanding the extent to which that can protect you and your mental health can be very important, especially if you have like an officer that is posted out in a village with very little people. Understanding the need of that officer to connect with people through distance or to make friends within the village can help a lot. Overall, it aims to facilitate an understanding of your psychology and your brain. We all have the same processes, but understanding how it works and where we can take control can be very beneficial. Again, it has very little or no preventative value, but it can lower severity and increase the chances of utilizing treatment for mental health related issues. Some lessons learned from pre-trauma training research and implementation include the fact that statistical significance is low or absent. That doesn't mean it doesn't have value, though. It can reduce the severity of developing PTSD or anxiety, but we shouldn't look at it simply as a preventative measure. It also can reduce the stigma associated with these conditions and encourage people to talk about these issues and to seek help. A lot of people don't talk about it within the workplace because they're afraid that it will impact their career. But especially educating upper management and middle management on the importance of helping those within the organization understand that taking care of their mental health can only help them be a better worker and not impede career opportunities or progress. The social environment created by these training programs can also be helpful because it encourages people to find others that they can talk about their issues with, and just make sure that the environment and the culture is more accepting of stepping in before the problem gets to be too big. There is also a lot more research needed with pre-trauma training. For example, when you talk about critical incident stress debriefing, it is widely regarded as a good method of taking care of people who have just experienced a trauma, especially within the medical profession, when in fact research on it has shown that it's not helpful at all, and in some instances can even be harmful with the ways that it is taught. So making sure that the research is distributed so that knowledge is current and updated can really help impact organizational decisions on pre-trauma training. Some examples of pre-trauma training include the U.S. Navy Stress Resiliency Training System that uses heart rate variability games so that monitor your heart rate to get you to pass through a certain level or a certain scenario by keeping control of where your heart rate is at. And this uses biofeedback techniques as well as CBT to help you take control of your body. The U.S. Army's Master Resiliency Training Program also implements elements of CBT as well as mindfulness. And the Penn Resiliency Program, which the MRT is actually based off of, goes into 6 very specific categories that are thought to be interdependent and collectively beneficial to increasing resiliency, including self-awareness, self-regulation, optimism, mental agility, strength of character, and connection. These are the resources I used. There are plenty more out there, so I encourage you to go out and do your own research. But it's very hard to find good sources that are free, accessible, and in depth. So these are 3 good places to start. Thank you for listening, and I hope you learned something.